Welcome to Quick Talks with Dr. Muse, and today we are going to be learning about opioids from the perspective of managing acute or chronic pain. Dr. Dan Muse is an emergency physician for Brockton Hospital, and he's been collaborating with the Oasis Coalition for a number of years, and he's here to share some information with you.
Thank you, Stephanie, and let's begin. So we're talking about acute and chronic pain, so obviously, what are they? And acute pain is something that's going to come on suddenly. It typically will result from trauma, could be post-operative pain. It's an injury. And in these cases, it usually will not last that long. And typically, after about 6 months, you should be feeling better. Now, keep in mind that some acute pain can turn into chronic pain. If you have a very bad injury, you may get better, the pain may be better, but you still may continue to have pain. The cutoff, let's say, is around 6 months. And if it's continuing after that, you're starting to look at chronic pain. It's hard to say how long this will last. And in some cases, if it's due to a medical condition such as rheumatoid arthritis, you may end up with that pain for the rest of your life. So ultimately, you still want to treat either pain the same way. You want to avoid opioids unless they're absolutely needed. And ice, elevation rest, Tylenol, Motrin, acetaminophen, ibuprofen, which are the trade names. These are all the first rounds of modalities that you want to use in terms of treating the pain. And if it is persisting, well, that's saying that you might need some more help. So there's nothing wrong with trying other types of therapies, and physical therapy, chiropractors can be very advantageous in terms of treating certain types of pain. And the way I look at acupuncture, well, it's not a pill. You can't get addicted to it. It's been around for over 3,000 years, so there must be something to it. And massage therapists, we're talking about people who are trained in massage therapy, not just going to a massage place where they also will do your eyes and pedi manis. But a real massage therapist can be very advantageous in terms of loosening the muscles and treating the pain, all without becoming addicted to opioids. So ultimately, there may be a case where you need to use these medications. And if you're going to use them, you want to make sure that you use them appropriately and that you only take them as prescribed. The idea there is that you will stay within a safe range and that they can be advantageous without causing the deleterious side effects, which is, in this case, you overdose, you stop breathing, and potentially die. And remember that, especially with opioids, the big side effect is that they cause addiction, and addiction can cause physical harm. So ultimately, never accept a prescription for narcotics without having the benefits and side effects explained. This is true with any medication. Every medication has side effects. So if you're gonna be sitting there and they're going to give you a medication, I don't care if it's an opioid or high blood pressure medication, they should let you know, your healthcare professional, what exactly the side effects are so that you'll be aware of them. And always, especially with pain management, always find out from your healthcare professional what else you can do. And lastly, especially with the opioids, don't ever accept more than a couple of days. You really shouldn't need more for acute pain management than 2 or 3 days. Now, again, I'm pointing this out. We're talking here about acute pain and not chronic pain. That is a whole separate topic in terms of how to manage that, one that we're not going to get into today. So never share medications that are not yours. Don't over-medicate with medications that are prescribed for you. Make sure that you follow the directions correctly, and don't ever mix narcotics with alcohol or other sedative types of medications. That is a surefire way to stop breathing and potentially die. Now, there are ways of getting rid of them, and hopefully, if you do get opioids, that you quite frankly don't need them and that you just had them as a safety valve. But there are kiosks at virtually any police station in Massachusetts where you can dispense of the extra medications, not just the opioids. They also have prescription take-back days, and certain medications you can flush down the toilet or throw into the trash, and the FDA has a list of that. So just keep in mind that the opioids have a high potential for misuse, diversion, addiction, and that if you do get a prescription, only use it as a last resort, because ultimately what you don't want to have happen to you is lead down the pathway of addiction, because unfortunately, if that occurs, it could also lead down the pathway to an overdose. So prevention works. If you do the right things, you can take medication safely. And if you need any more information, just go to stoughtonoasis.org. Thank you for your time.
Thanks, Dr. Muse. And check out, we have one last episode in this 3-part series. So if you're interested in learning more, you can find it also on our website. Thanks. Have a great day.